breeding ground for some pretty nasty germs.
So why would medical workers wear their surgical scrubs and white coats out to eat in restaurants and to run errands? Health Watch reporter Beth Galvin is here now with her special report, Hidden Hospital Dangers. Beth?
And Russ and Amanda, hospitals across the country are increasingly focused on reducing the spread of deadly germs. But some of these doctors and nurses look like they walked right out of the operating room and into your local restaurant without bothering to take off their protective shoe covers and surgical caps.
You've probably seen this before. Doctors, nurses, and other workers dressed in lab coats, even scrubs, out and about from sidewalks to restaurants. The question is, could this be putting you at risk?
Wearing these scrubs and white coats in public is a dangerous fashion statement.
So dangerous, Betsy McCoy's organization, RID, the Committee to Reduce Infection Deaths, is zeroing in on hospitals across the country.
To stop allowing workers to leave the hospital in their heavily contaminated uniforms.
Her organization took these photos, she says, show the medical community needs to make big changes. And if you think McCoy is taking it a bit too far, experts say drug-resistant bacteria is spreading at alarming rates, infecting hundreds of thousands of people. Bacteria like MRSA and C. diff that can make you very sick, even kill you.
Unlike most of the other bacteria you've heard about that invade your body through an incision or an IV, this one can make you sick simply by getting in your mouth.
And that has doctors at some hospitals changing the way they operate. And it's not just about washing their hands, it's about what they wear. MRSA and C. diff can survive on clothing or cabinet surfaces or on the phone or your hands for a long time, weeks on clothing and fabrics. And Dr. Michael Perry says the organisms don't disappear until the coats and scrubs are cleaned. Things are different in the operating room. They're tightly controlled, and scrubs are usually taken off right after an operation. That's why RID is targeting other areas of the hospital, where workers in their scrubs come into contact with dozens of patients and then move on. We found lots of hospital staffers running lunchtime errands, still wearing their surgical caps. Some of them even had their protective shoe covers on that they wore into the operating room.
We spoke to several Metro Atlanta hospitals, and none has a policy specifically banning employees from wearing their uniforms out in public. It may not exactly be appetizing at lunchtime, but there's no evidence it's a health hazard. There's also almost no research on this issue.
So, you see lungers in lab coats, leaning on the glass, sitting down, this one with their sleeves resting right on a table.
They pick up bacteria as they go from patient to patient. Then they leave the hospital, go into the delis and restaurants and deposit it. And in one study, 20% of nurses' uniforms were contaminated with C. diff at the end of the shift.
Should you worry about what these people are wearing? Dr. Perry says maybe not. But it's enough of an issue that rules are changing here at Stamford Hospital in Connecticut.
We do not want people out in public in lab coats. We do not want people in the public in their scrubs that they've been wearing in the hospital.
And just to be extra safe, the hospital is color-coding scrubs, all to control the spread of bacteria.
There's new strains that are much more virulent and much more dangerous that, unfortunately, treatment is hard to enact for. So it's just heightened our intensity about environmental concerns.
But he's not just concerned for people outside the hospital. It's patients inside, too.
It's really a two-way street.
Because if these workers contaminate their scrubs outside and then go back into the hospital, they could potentially pass it along to dozens of patients.
They're endangering their own patients by carrying the germs from bedside to bedside.
And they might not have a clue.
And most non-surgical hospital staffers wash their own uniforms between their shifts, but the hospitals launder any scrubs that are worn into surgery. And OR employees usually put their scrubs on at the beginning of their shift and then take them off before they go home. But Russ and Amanda, unfortunately, it looks like they're going to lunch and running errands and everything on their break.
This is not something I would ever have thought of. Yeah. And neither would I have thought to worry potentially about what I'm wearing when I walk into the hospital to visit somebody. Should we be worried about our street clothes?
I don't think so, because when you go to the hospital, you're going to visit one person. The difference is you're not going from room to room, patient to patient, potentially spreading germs from one person to another.
Illness to illness.
Yes.
All right. Good advice. Thank you, Beth.
Thanks.
The Fox